Good morning, everybody, and welcome to your Monday edition of your Lunch Break Live. My name is Ivana. If you are new here, if you are not new here, thank you so much for coming back. Today, obviously, I do not have Mr. Fagan here with me at the moment. He was having some internet issues. I think it's Monday for all of us, but hopefully here in a minute, I will be joined by the O'Neal Cancer Center's Community Advisory Board, Jerry Fagan, and board member Jerry Fagan, I should say. And Mr. Fagan has a lot to say and a really interesting story about his journey advocating for prostate cancer awareness. Now, it is Prostate Cancer Awareness Month, and there's a lot of talk going on about the different types of awareness of cancers and maybe how prostate cancer awareness is not number one on that list. So there are people trying to change that, like Mr. Fagan. Hopefully we'll get him on here in a minute. But in the meantime, I actually have a oncologist, a urologist oncologist, I guess I should say, from UAB, who I talked with a little bit this morning. Now, again, this was not live. I talked to him this morning because he had a surgery at 11. So obviously that comes before the show and these videos. So I went ahead and talked with Dr. Reese Barami. I had to make sure I said that correctly. With Dr. Reese Barami this morning. So what I'm going to do is I'm going to go ahead and play that video for y'all talking about prostate cancer awareness and a really interesting and very sad fact that Black men are more likely to die of prostate cancer 2.5 times more likely than white men and of men of other races and ethnicities. So really sad stat here. The doctor kind of talks a little bit about that. And hopefully when we get done with that video, I will have I will have Jerry Fagan back here to talk about his journey of advocacy. So here's a couple of minutes of this talk with Dr. Reese Barami about Prostate Cancer Awareness Month. Now, Dr. Reese Barami, tell me what you do at the Cancer Center at UAB and why this month is so important.
So I'm a urologic oncologist at UAB with special interests in screening and treating men with prostate cancer. One of the main focuses this month is obviously prostate cancer awareness. And I think it's essential that we as a community always discuss the appropriate screening for which we can do blood tests and examinations for early detection of prostate cancer to allow us multiple opportunities for adequate treatment with curative intent and great successes.
Now, I know this is Prostate Cancer Awareness Month. What can people do to ensure that they are getting the proper screenings and the proper checks, especially in a time where so many people probably don't feel comfortable going to doctor's offices or would just rather stay home if they could?
Absolutely. So obviously from a public health perspective, you mentioned the obviously COVID-19 pandemic, which is foremost on everyone's mind and obviously cautions with that. Now, even PSA screening and prostate cancer screening has gone through a lot of controversy, I would say, over the past 5 to 10 years with the U.S. Preventative Services Task Force and various organizations, both the American Urological Association and the National Comprehensive Cancer Network, all having different guidelines. And sort of how to integrate those into the current pandemic is obviously a really good question. And there's no, absolute right answer. What I would say is any man, based on NCCN guidelines between 45 and 75, should have discussions with their primary care docs or their urologists in regards to the appropriateness of screening and their personalized care.
Now, we have seen some stats, especially provided by UAB, that Black men are more than 2.5 times likely to be diagnosed with prostate cancer. Why is that?
I don't think we absolutely know it pinned down to the exact cause, but there certainly is ethnic, racial, and family history components to increased risk of having prostate cancer diagnosed, prostate cancer of a higher aggressiveness, higher grade and stage potentially, and even earlier onset of prostate cancer cases. And certainly, as you mentioned, in the African-American population, Caribbean population, patients with a known family history and first-degree male relatives. These are patients that should be keyed in and aware of their screening opportunities, potentially at an earlier age, or at least to start those discussions with their care providers.
Does that mean that white men or men of other races and ethnicities should not be maybe as stringent about getting their testing or their screening done?
So I would not say that. I would support, the widespread approach to counseling, discussion, and consideration of screening in age-appropriate men. We recognize that prostate cancer incidence goes up based on men's age. That's a number one known risk factor. The other risk factors and associations that we talked about in terms of race and ethnicity and background and family history are additive. But again, age-appropriate screening should definitely be discussed in every case. And then a decision is made between docs and their patients in terms of the risks and benefits of screening in each individual scenario.
Now, again, that was a quick talk with UAB's Dr. Reese Barami, who is an oncologist and specializes in urology at the O'Neal Cancer Center at UAB. Now, I was hoping by the time we got finished with that talk, again, that was filmed about an hour ago because the doctor had a surgery at 11, which takes precedence over this, obviously. And so I was hoping to be able to talk with the O'Neal Cancer Center Community Advisory Board member, Jerry Fagan. Now, Jerry Fagan is from Butler County and has moved back to Butler County after about 20 years here in Birmingham. And he is an advocate for prostate cancer awareness after his father died of the cancer in 1997. I'm referencing my notes here to make sure I get that right. And he said at that time there was very little talk of the disease, and especially in his area. So he worked very hard to spread the word about prostate cancer awareness and screenings, early screenings to people in his community. Again, we heard that grim statistic from the doctor about how Black men are more likely to die of prostate cancer, 2.5 times more likely than their white counterparts. So Mr. Fagan worked hard to spread that message. He himself was diagnosed in 2013 with prostate cancer. And in 2015, he coordinated with the Urology Centers of Alabama, which is located in Homewood, to coordinate annual prostate screening clinic in Butler County. Now, he said that annual prostate screening clinic in Butler County has a good turnout, a big turnout. He said that they usually there are many people who are diagnosed with that prostate cancer after those screenings. And let's keep in mind, Butler County is south of Birmingham. It's in the southern part of Alabama, located in the Black Belt. So he's really working hard to spread that message there. Unfortunately, I think he was having some internet issues. Again, I think that we all understand that now working from home in this pandemic. So unfortunately, we're going to have to get with Mr. Fagan later, but we will leave you all the information that you need to know about Prostate Cancer Awareness Month, about the board that Mr. Fagan sits on to get that message out, to spread that message. And hopefully we can bring him back here later today for you so you can hear his incredible story and his journey to spread that message. So that is your short lunch break for today. You have a little bit of extra time to eat your sandwich before getting back to work. And I appreciate you joining us. We will see you tomorrow. Everybody stay safe in this weather.